So I'll start by introducing myself. My name's Amber. I'm a nurse and midwife by background. Most of my previous work has been in the NHS, working across both inpatient and community settings. I now work for Compassion in Dying as one of their specialist nurses. So this involves speaking to people across the country on our free nurse-led information line and via email about planning for their future care, empowering people to make decisions around their health, particularly at the end of life. So as I said, I'm going to spend the next hour or so talking about how you can prepare for the end of life, specifically by documenting your wishes. We will cover different options to plan and document your wishes for yourself, why planning ahead is so important, and how it can help us all to achieve an end of life that aligns with your wishes and values. We will also touch on some of the barriers to planning and some of the unfortunate implications of not planning. So this session is an overview over how you can plan ahead. You may finish with questions or wanting to know more, and we will let you know how you can get in touch with myself and the team for more information. Okay, so just a little icebreaker now. I realise this is quite high tech and I haven't done this before, so don't worry if it doesn't work, but maybe Carly, you can give it a go for me. But there's a little QR code in the corner. If you have a camera phone, you can scan it and just type in a word of what comes to mind when you think of advanced care planning. And I just want to start out, so sorry, whilst you're doing that, hopefully the words will appear on the screen, but I just wanted to start out by saying that we hope this will be an insightful and interesting conversation. We know some people, as Carly said, find it uncomfortable talking about death and dying, so please do feel free to take a break at any point of the webinar. What we find at Compassion in Dying is that there seem to be a lot of great initiatives around death and dying at the moment, which help break down the taboo and stigma around death. You may have heard of things like death cafes, but in our opinion, there is not enough out there that discusses how to actually record your wishes, which is where we come in. I don't know if this is working, Carly. We did give it a go before people came in, but if not, we can just move on. That's absolutely
Yeah, it's
fine.
not weird for me. I've just sent another one in, so no, it didn't.
That's okay, no worries. Can you see the slides okay though, Carly? They're moving and everything.
Yeah, absolutely fine.
Brilliant. Great. Okay. So one of the key things we've learned through our research and from what people tell us on our information line is that there's a worrying disconnect between what people want at the end of life and what they're actually doing to prepare for it. Lots of people across the UK have very strong views about what happens at the end of their life, but actually very few of them would want a doctor that barely knows them to be making final treatment decisions for them. But despite this, less than 10% of us formally document our end of life wishes or give anyone the formal decision making authority. So, why is this? People often don't know what their options are, which is why sessions like this are really important. Many people think that, understandably, being a next of kin or being married to someone for a long period of time is enough. And people wrongly think a solicitor is required to do anything that's legally binding. And this is really sad because that could be a financial barrier for many people, and a lot of the time it just isn't necessary. So I use the time this evening to provide what I hope is an informative overview of how decisions are made when you're very unwell and how you can think ahead and prepare for these decisions well ahead of time if you wish to, helping you to remain in control when you're so unwell that you can no longer make the decisions for yourself. So I'll just briefly explain who we are at Compassion in Dying. So simply put, we're a national charity that supports people to prepare for end of life by talking about and then documenting in advance their treatment and care wishes. We believe that everyone should be given the information and support needed to make decisions about their treatment and to plan ahead in a way that helps to ensure that their wishes are known about and if they one day lose the ability to communicate these wishes for themselves. So how do we do this? As I mentioned, we do it on our nurse-led information line. We provide free resources by post. We have an online living will service that the NHS website actually signposts to. And whilst we used to focus on entirely supporting people to plan ahead for end of life, more and more we're helping people who are having difficulty right now with their own wishes being respected, or difficulty advocating for a loved one whose wishes aren't being respected. So let's just take a little moment to think about how decisions are made. So obviously there's a GP here talking to a patient, but when making decisions, it's important to consider mental capacity. I'm sure most of you know what having mental capacity means, but to recap, it means that a person is able to make and communicate a decision for themselves. If someone is unwell and a decision needs to be made about what treatment to have at end of life, people who have capacity will make that decision themselves, even if they want to refuse a life prolonging treatment and that decision brings about their death. It's their decision. But if you are unwell and you lack the ability to make these sorts of decisions, then a doctor will need to do this in your best interest, unless you have some form of formal documentation in place already that covers these decisions. I'll be talking about more about the ways you can do just that and how you can put those documents in place. So now I'm going to give a bit of an overview of the ways you can do this for yourself and with your healthcare professionals. Okay, so I'm going to go through the different person-led tools for advanced care planning. I think it's important to say here that please don't feel you have to memorize all this information. It's a lot to take in, even for me. It can be really overwhelming sometimes. So we're going to go through each of the forms in more detail. Tonight, really, I just want to let you know what is out there and the range of ways you can document your wishes and plant that seed in your brain to get thinking about it. So we're going to start with advanced statements. I like to think of advanced statements. I don't know if anyone remembers that program, but This Is Your Life. It's kind of an overview of who you are and things that are important to you in your life and you as an individual. They can be really useful in documenting, for instance, your preferred place of care, your preferred place of death, such as wanting to die at home, in a hospital, in a hospice, or a nursing home. How you would like any religious or spiritual beliefs to be reflected in your care. What you might like to be called. So you might be called David on your birth certificate, but no one calls you David and you want to be called Dave. What you like to eat and drink, how you like your cup of tea, this sort of thing. So the advanced statement can be shared with your family and healthcare professionals. This can be as detailed as you like. It's really helpful in terms of supporting your environment and care needs being met, whilst when you might not be able to express these preferences. They can also help open up conversations with loved ones, but it's important to note that advanced statements are not legally binding. So moving on to advanced decision. These have lots of different names, which can be confusing. So sometimes people call them living wills, advanced decision, advanced directive. The proper name is advanced decision to refuse treatment, ADRT for short, which is what I will use for the rest of the webinar, but they're all the same thing. So just to let you know at the outset, in case it does get a little bit confusing. So an ADRT is a legal document in which a person can refuse specific medical treatments in the future. As said before, even if this means refusing a certain medical treatment that may lead to their death, and it's only used should they lose capacity to make those decisions themselves. It's legally binding in England, Wales, Northern Ireland. It's not legally binding in Scotland. However, medical professionals are expected to take them into account when making any best interest decisions. And then moving on to lasting power of attorney, and we are going to go over these in more detail. So I know it's a bit of a whistle-stop tour. But it's important to note that lasting power of attorney, this refers to health and welfare, as sometimes it gets confused with LPAs, lasting power of attorney for financial decisions. So lasting power of attorney for health and welfare is where you can officially appoint someone you trust to make decisions for you. Giving someone power of attorney means that you give another person the right to make decisions about your care and welfare. Okay, so as I've said, there's a few different names. So you've got the living will there as well. So you can actually see, it's probably quite small on the screen, but you can actually see an example of the form that we provide, the advanced decision to refuse treatment there. So whilst you need to complete this form whilst you're able to make decisions, it will only be used, as I said, if you later lack the ability to make or communicate the decision yourself. You don't have to be ill or old to complete an advanced decision form, but you must be an adult and you have capacity to make the decision at the time of completing the form. So, to recap, you can use this form to refuse any medical treatment you don't want to be given in the future, only used if you are unable to make or communicate this decision for yourself. It's legally binding in England, Wales, and Northern Ireland, not in Scotland, but usually they are followed there. And at Compassion in Dying, we provide these for free and support people to complete them. Again, I'll explain later in the webinar ways we can do that. So I just thought it'd be nice to bring in a quote from Mary, a lady who called our information line, to show you the impact that having an ADRT in place can have. I'll let you read it at your own pace, but Mary talks about how making sure the GP was aware of the ADRT and had a copy of it at the GP surgery allowed her husband to stay at home where he was comfortable in the last stages of his life instead of having a hospital admission and treatment that he didn't want to have, which I think is so powerful as it's allowing people to have a good death where they feel in control. Hopefully everyone's read that. I'll move on. So once the ADRT or forms have been completed, then they need to be signed in the presence of a witness who signs and then you, sorry, I'll start that again. So once the form has been completed, they need to be signed in the presence of a witness who also signs and dates the form. It is then ready to share. So the witness can be a friend or a neighbour. It doesn't have to be anyone official like a solicitor or a doctor. We then suggest that people make copies of the completed document and share those as widely as you can to help ensure, if it's ever needed, that it can be followed. So, for example, this could be with your local hospital trust, your GP, your specialist nursing teams. So, for some of you, that will be your cancer nurses, friends and family, a copy at home, local ambulance service. I'm sure many of you will know from experience that record sharing and communication can be quite poor in the NHS. So just know that you can everything that you do to make sure you can do everything you can to get it to the people that matter the most and that you know are hopefully going to see it. Okay, so moving on to lasting power of attorney, which I'll refer to as LPA. So LPA is a way of giving someone you trust the legal power to make decisions for you. As touched upon before, there are two types, one for finance and property affairs and the others for health and welfare decisions. In most parts of the UK, there's the option of having the financial version, but it depends on where you are in the UK as to whether you have the health and welfare version, so just check that before completing it. We don't, at Compassion in Dying, support people with the financial version as it's not our area of expertise, but we do support people with queries about the health and welfare version of this form. And we also support people who are attorneys as well who feel they're not being listened to. There's something called the Office for Public Guardian, which is who produce the forms and who you have to register it with once it's completed. And I can share their helpline because they've got a really good helpline that you can call if you're having particular difficulties with the form. So why is an LPA important? Well, as I mentioned before, your next of kin has no legal right to make decisions for you unless you have appointed them power of attorney. An attorney, or the people you give this authority to, can step in and make decisions all about aspects of your health and welfare, depending on how you choose to complete the form. Examples of what to put in your LPA could be where you live and where you're cared for, your daily routine and diet, medical care and treatment options, which could include life-sustaining treatment decisions, people you see and spend time with, and things that you like to do or how you get dressed in the morning. So, a bit of an overview of your day to day routine as well. So, I've got another quote here, this time about an LPA being used from Alan, who called our info line, and he had an LPA in place for his mum. As I'm sure all of you here tonight are aware, a condition or illness doesn't just affect the individual, it affects and has an impact on families and support networks around that individual. So, having those who matter to you involved in your care early on can really provide peace of mind for everyone for the future. Okay, so as mentioned, these forms are provided by the Office for Public Guardian, a government body. They're the one that produced the form. You complete the form by hand or online. It can take up to 20 weeks to be registered. It is legally binding and it only comes into effect if you lose capacity. Currently, there are no LPA health options in Northern Ireland or the Isle of Man. And I put a little asterisk by Scotland as solicitors there are more involved in the care. The cost of it is £83. And if you want more information, you can just Google lasting power for health, lasting power of attorney for health and welfare, and it should come up with all the information. But if you're having any difficulty, I'm happy to send that out to people. Um, and sometimes people think, oh, I don't need to do this now. I'll just wait till my condition worsens or when I'm older. But as it says there, it can take up to 20 weeks to be registered. So obviously that's a really long time. And with this particular form, we advise not to leave it to the last minute. It's one of the ones that's good to do early. Okay, so moving on to the advanced statement form, which we touched on earlier. It's a way of documenting what's important to you and what makes you you. So I think I mentioned earlier, but people include things like your values, religious or spiritual beliefs, important people in your life, your lifestyles, habits, your food preferences, any allergies, where you live, where you want to be cared for at the end of life, and any important information about your health. So this is another form that we provide at Compassion in Dying. And when I say we provide them, they're available to do on our website. You can go on our website and fill them in, or we post them out as well. So, an advance statement, as I mentioned before, isn't legally binding and they might be used when making decisions on your behalf. So, yeah, that's the main thing is that it's not legally binding, but when used with the other forms, it can really help guide your care for your healthcare professionals. So, we've spoken about some of the ways that you can take control and document your wishes for yourself. However, that can be confusing for people. And you sometimes just don't know like what form is right for me. Sorry, I thought my slide stopped then. So yeah, it can be confusing and not knowing which one's right for you. It's especially confusing when some of them sound similar and they cover similar information. To make things more complicated, there isn't a one system type form across the UK. So, for example, you might have heard of things like a respect form in some parts of the country or DNAR forms. These are useful documents and important forms that can outline clinical recommendations, agreed approaches, and how to recommend or how to recognise deteriorations and how they should be managed. So these are not legally binding documents, but they can work nicely alongside person-led forms like an ADRT or an LPA, as long as the information in there doesn't clash. That's really important. Depending on your circumstances and what you want to do or not do, having one or a combination of these forms is fine. It's not a case of one trumping the other. It's up to you which ones that you want. If you want to have a combination, that's fine. If you just want to have one, it's fine. Again, it's all about your choice and your care and empowering you to make those decisions. So following on from this, here's a bit of a visual aid to show how they differ. As you can see, the clinician-led forms are more used as a communication tool. So, for example, if you're in hospital, it's kind of used between clinicians. So, a nurse handing over to another about how to care for you when a clinician's never met you before. And the advanced decision is a lot more person led. You're the one that creates it and writes it. It allows you to refuse treatment, and crucially, it's legally binding. Okay, so I know that's been a real sort of whiz through the forms there, but I just want to reiterate that please don't feel like you've got to remember it all, and completing the forms is obviously a really important part of the process, but it's just the beginning. So, sharing your forms, we recommend that printing them, having a physical copy of your form to hand in a safe place at home, as well as sharing them with those close to you. It's also important to share them with your GP or any clinical team so that they can be uploaded to your medical records. We also provide wallet-sized cards, not cards, wallet-sized cards to inform people that you have an ADRT in place when out and about, instead of having to take forms out and about with you. So finally, here's some next steps that you may want to consider going forward after tonight's webinar. So think about what matters to you. And we always encourage people at Compassion in Dying to just have that conversation with your loved ones. Sometimes, having these conversations are really difficult, but what we hear is that people on our information line, that people sometimes had these conversations or wish they had these conversations sooner, and then it is too late. So try and have these conversations early, speak to those that are important to you and involved in your care about what really matters and what you want to happen to you at the end of your life. Record your wishes. So as I said, you can go on our website if you're able to go on our website. If not, then I'm happy for you to call me. I'll give Carly the number, and I've got the numbers on the next slide. But we have an information line which you can call, and we can take your details and send a form out to you in the post. We also review forms. So if you then get your form and you're not really sure what exactly to put in it, or you just want a little bit of guidance, or you do know what to put in it, but you just want us to glance our eyes over it, we're more than happy to do that as well. Um, yeah, and just contact us along the way if you need any help with that. Okay, so most of all, I just want to say that you don't have to do this alone, as I've said already. There's our information line number. We are open quite a small window as we're a small nursing team, so appreciate that our opening times are very little, but if you don't get through during that time, then please, if you're able to, email us and we can call you back outside of those times. And we're hoping to extend the times when we expand our nursing team in the future as well.